Jongle, Upper Nile, and Warab. By collaborating with iRadio, you can connect with diverse communities and target audiences in these regions.
Community engagement partnering with iRadio means engaging with communities at a grassroots levels. Your message will resonate with listeners in various locations, fostering meaningful interactions and driving brand awareness.
Comprehensive coverage with stations in strategic locations like Reng, Malakal, and Baliet. iRadio offers comprehensive coverage that reaches both urban centers and remote areas. Your partnership with iRadio ensures visibility across a wide geographic area.
Don't miss out on the opportunity to amplify your message with iRadio. Partner or advertise with us today and make your voice heard across South Sudan.
This is iRadio. When contributing to a topic on the radio, please avoid statements that may incite or promote hate. We encourage constructive points of views and criticisms that aim at providing solutions to problems facing the country. We do not want rumor mongering or information that is regarded as hearsays. We advocate for messages of peace and unity among the people of South Sudan. This is iRadio, your eye on South Sudan.
عزيزي مستمع إذاعة آي راديو، لما تشارك في أي موضوع على الإذاعة أرجوك تفادي تصريحات بتحرض أو بيشجع على الكراهية. إحنا بنشجع نقد بناء وآراء هادفة اللي بتهدف إلى توفير الحلول للمشاكل اللي بتواجه الدولة. إحنا ما دايرين ترويج للشائعات أو المعلومات اللي بتعتبر بأنها شائعة أو أغاويل. إحنا بندعو إلى رسائل السلام والوحدة بين مواطنين جنوب السودان. ده آي راديو، عينك على جنوب السودان.
The Dawn on iRadio.
Right, a very good morning to you, and now welcome to the extended third hour of the Dawn program for today here on iRadio, a live broadcast from the capital Juba, and I'm your host Emmanuel Joseph Akile. And remember, today is Friday, the 28th of November 2025, coming to 17 minutes now after the hour of 8. Now in the third hour of the Dawn, we are going to talk about a very important national event. That's the Health Summit, which is expected to take place here in the capital Juba from the 2nd to the 5th of December or next week. And the summit will actually bring together government officials, development partners, health professionals, civil society, to among many others, to discuss future of healthcare system here in the country. So to guide us through what this summit will really mean for our country, I'm happy to be joined live in the studio by two guests I have with me. Dr. John Rumunu Pasquale, who's Director General for the National Ministry of Health. He is Director General for Policy, Planning, Budgeting, Research and Monitoring and Evaluation. As I have with me in the studio, Dr. Michael Mading, who's Director General for Reproductive Health, both from the National Ministry of Health. It's good to have both of you in the studio, doctors and gentlemen. Welcome to our radio.
Thank you for having us.
Right. Dr. Romuno, let me start with you. I'd like you to provide us with a brief overview about the Health Summit, which is actually expected to be conducted very soon here in the capital, Juba. And what brought about this idea, and is it the first of its kind? How is it going to look like? You can take us through that, please.
Yeah, thank you very much, Akile, for hosting us, and especially on this important topic on the National Health Summit organized by the Ministry of Health together with stakeholders, including State Ministry of Health, County Health Departments, and our partners. The Health Summit is organized by the Ministry of Health under the leadership of Honorable Sarah Kiletu, Minister of Health, to dialogue and deliberate on findings of annual health sector performance review. Just going back to your question, like what actually triggered it, we are very happy for our leadership in the Ministry of Health, led by Honorable Sarah Kiletu and Undersecretary Honorable Dr. Kennedy Ganiko. This year, the Directorate of Policy, Planning, Monitoring and Evaluation, together with other directorates, have been commissioned to develop annual health sector performance review, and we develop a report. And this summit actually will use that report for dialogue and deliberate on the findings. The summit responds to a national imperative to comprehensively assess the performance gaps and opportunities across the entire health system. It will convene senior leaders from government, civil society, development partners, academia, and private sector in a unified effort to validate strategic reforms, harmonize investments, and accelerate implementation. Akile, it is not only convening, it is actually also a turning point. It is a turning point and a platform for to transform fragmented initiatives. As you know, we have many partners supporting different health programs, and many are fragmented, but this time around this platform will help bring the fragmented initiative into a coherent, accountable, and people-centered health architecture that delivers measurable impact and equity for all. And above all, we are very happy because the patron of the summit is not other than His Excellency President Salva Kiir Mayardit.
Right. Thank you for that elaboration and that brief background and the importance of how this event is going to look like. Now, Dr. Michael, let me come to you, and I would like you also to tell us some of the key activities that will really be covered in the summit, and can we anticipate, or can we take us through the atmosphere? How is it going to look like? What are the real issues that are going to be addressed, especially since you are the Director General of Reproductive Health, and this has been an issue here in the country, Doctor.
Yeah. Thank you for hosting us this morning in the iRadio, and I would like to extend our profound thanks to the team in iRadio for having this special program on the Health Summit in South Sudan. As my colleague Dr. Joro Muno has put it, the summit is one of the biggest events at the health sector in the country, and it is going to bring different partners and stakeholders that will be attending this. And also we have participants also coming from the states. And within the 5 days of the summits, definitely there is a lot of activities that will be taking place. And the activity that we have within the summit is being divided into thematic areas that we will discuss issues related to communicable diseases like malaria, HIV, tuberculosis, this will be discussed thoroughly, and all the issues that related to health conditions in these aspects. And we will come out with a clear focus and what need to be done in the certain period. We also, the other thematic area is the non-communicable diseases like cardiovascular diseases, and, diabetes mellitus, and respiratory diseases. This is something emerging that is coming up, and it is actually one of the alarming situations that we also, Ministry of Health, want to focus on it to ensure that we provide the services in the country, and especially issues to do with diabetes mellitus at the moment in the country. The other thematic area that we definitely will be discussed within the summit is the reproductive health and maternal and newborn health care child services in the country. And this one is also, we will address issues how our women are not being provided with the quality services, and how this one should be provided. And this also we will hear from the states what is happening in the states in terms of the achievement that we have achieved in this perspective, and then also what are the plan for the futures. On the other note, we will discuss on the emergency preparedness and response, and especially this one is to address issues that are cross-cutting in the healthcare system in the country, issues of the diseases outbreak, which actually we need a preparedness to the country to be ready to tackle it. Of recent, maybe you heard of the outbreak of cholera, and how the country has actually been working very seriously on that one and ensuring that we combat this disease. Generally, there's discussions that also will focus on the issues to do with the health system in the country, and how should we strengthen the health system in the country. This is one of the most important areas to ensure that we have a resilience and sustainable delivery of the healthcare systems in this country. The last topic that will be deliberated within the summit is issues related to human resources for health. And of course, a country has invested a lot in development of the human resources for health, and ensuring how the policies that should be put in place to make sure that we have retention of these cadres, and how they will provide the services. A part of all these thematic areas, we still also have a number of documents that will be launched during the summits, and we will also hear from the state presentations. They will present to us about how they are implementing the healthcare services, and also issues related to community health programs that we have in the country. We call it Boomer Health Initiatives. So all these aspects will be discussed thoroughly in the summit. And lastly, it is actually the ministerial initiative on providing the maternal and child health services in the country. So these are all activities that will be discussed. And lastly, we will have a communique that will be communicated and as a resolution of the summit. So these are some of the things that will be discussed in the summit itself.
Right. Right. Thank you for that. And Dr. John, also understand we're expecting like the launch of some documents or anything to do with that, and we would like to know the significance of such a move for the future of health sector here in the country.
Yeah. Thank you very much. The launch of document is one of the highlights we have. Among others, during the summit, there will be launch of key documents like the annual health sector performance report I already mentioned in my earlier intervention, and also we have trends with death by cause in South Sudan, or trends of death by cause in South Sudan. This from 2019 to 2022. And also we will have health statistics report for 2025. as well as launching of ministerial initiative on maternal and newborn health. So these are important. As you realize, the documents are mostly on information, data. Without data, you will not be able to organize health services based on science. So we are really happy that we have all this information, which will help the health sector to shape new architecture for health in the country.
Right, and since you mentioned the issue of the document, I would like also to come to you, Dr. Mading, and if you talk about this policy dialogue on, let's say, the Maputo Protocol, for example, and the launch of the ministerial initiative on maternal and newborn health, what does it really entail?
Yeah, thank you. Maputo Protocol is one of the African Union initiative, and it is actually adopted by the African Union in 2003 in Maputo in Mozambique, and has come to effective in 2006. And in these protocols, it is actually a landmark to provide women's rights for services that are needed for the women. And in the Maputo protocols, if you visit it and see it, you will see that what are being provided within it. It is a political participations for our women that we need them to factor in and to come very clearly, and social and economic equality for the women, reproductive health and autonomy for our women, and protections from the harmful practices. These are the old things that actually have been coming up within the Maputo protocols. So since Maputo protocols is the African Union initiative, and South Sudan is a member state of the African Union, it has been ratified actually in 44 countries out of 55 African countries. And South Sudan is one of the countries that are actually ratified these Maputo protocols. So we think this is an important opportunity for also to enlighten our peoples on the rights of the women in the country, and how the women should be participating in the politically, economically, and also how should we provide the rights for these women in the practices that are very harmful to their life. So the Maputo protocols is an opportunity for us, for lawmakers, to broadly bring them together so that they are enlightened about the rights of the women and everyone, and our women also. This is an opportunity also for them to know that they have been actually their rights has been articulated in the laws of the country, and this is an opportunity that these laws and this initiative are being translated into our local laws in the country. And this has happened. In actual fact, we have a number of laws that are actually protecting women in this country. So the opportunity we are bringing up on these protocols is especially to enlighten our people about the importance of the protocols and how the women should also participate with their rights in this.
Right. And a little bit far away from the Maputo protocol, Dr. Rumuno, let me come to you and let's talk about the launch of what about the launch of the malaria initiative known as High Burden, High Impact Malaria Initiative, Doctor?
Yeah, thank you very much. The topic on malaria is very important. Talking of high impact, as you know, malaria is a leading cause of morbidity and mortality in the country, and we have the science. We know how malaria is transmitted, and there are interventions for prevention, diagnosis, and treatment. However, it still remains the highest burden of disease in the country. So the high burden and high impact malaria initiative is a targeted country-led approach to malaria control that uses data to focus interventions on areas where the burden of disease is highest. As you know, South Sudan is big, and we have different types of vegetations and terrain, and so some areas are having more burden of malaria than others. So the initiative aims to get malaria control back on track by prioritizing political will, strategic information, better guidance and policies, and coordinated national response. There are key actions which include using detailed risk maps to guide the deployment of interventions like the long-lasting insecticide-treated nets, as well as ensuring that interventions reach the most vulnerable population in hard-to-reach areas.
Bring us about 25 minutes to the top of the hour. You're still listening to the Dawn program. بنتكلم في المنتدى الكبير اللي جاي، وده حيكون بتاع الصحة، وحينظمه وزارة بتاع الصحة القومية. حيكون من يوم 2 ليوم 5 في شهر 12، وده في الوزارة بقيادة بتاع الوزيرة سارة كليتوريال. We will shortly pick few calls on 0911 or 2298696. We also have a number of questions, or let's say comments here on our Facebook page. Marco Along here wrote on our Facebook, congratulations. Joke Kanyaro Joke is also saying congratulations. And we also have Dak who wrote on our Facebook, amazing. That is Dak Pok Kwong. And then we have Komaki Dominic said, congrats to the team of health professionals in the Ministry of Health, and congrats to Dr. Rumuno. We have Rejoice Johnson who said, when is the summit? I am an epidemiology student in Nairobi. I would like to attend the summit. That's the question. You earlier mentioned about the people who will attend the summit, but a student who's interested to attend this such summit, forget about how she will actually arrive to Juba or not, but maybe she missed the part where we talked about when is the summit going to happen as a student. Yes, maybe Dr. Michael, you can briefly respond to her on our Facebook. She's watching us live now.
Yeah, thank you. And the summit is an open forum for the healthcare workers and for everyone in the country or outside the country. And as we put it from the beginning, we said is bringing all the stakeholders, whether you are students or you are medical professionals related to the health. So everyone is welcome to attend the summits and also to follow up on the discussions that related to summits. So for our student who is actually following us this morning, we are happy also to see you to be part of this summit. And summit will start on the 2nd of December up to the 5th of December.
Right. So. And even through iRadio partnership probably with the ministry, it can also even be broadcast live on our social media platform, and maybe they can also still follow from wherever they are and share their views as well, right?
For sure.
Right. Let's make a few calls now on 0911 or 229-86986, or send a text to 139-86986. Remember, also live on our Facebook page, you can drop your question or your comment there, and that will actually bring you right away to the studio. You have senior officials here from the National Ministry of Health. We're talking about the upcoming health summit here in South Sudan. Have your say after the break.
Radio, your eye on South Sudan.
Your eye on South Sudan.
عندك أي سؤال في مجال بتاع الصحة في البلاد، ده الوقت ضيوف بتاعنا في الاستوديو من وزارة الصحة القومية، وده الوقت اللي فيه انت ممكن تقدم تعليق بتاعك. الضيوف في الاستوديو هم الدكتور جون رومونو باسكوالي، هو طبعا دايركتور جنرال بتاع بوليسي بلانينج بادجيتنج ريسيرش وكمان مونيتورنج اند ايفالويشن. وعندنا في الاستوديو الدكتور مايكل مادين دايركتور جنرال بتاع ريبرودكتيف هيلث. عندك اي سؤال للضيوف بتاعنا في الاستوديو، ده الوقت اللي انت ممكن تقدم سؤال بتاعك. Hello Radio. All right, I'll just still wait for the calls. Think maybe you have some technical problem with our lines there. But then, Dr. Michael, let me come to you and let's talk about, and this is something many people are actually asking or wondering out there about. Such events continue to happen, even if this is the first of its kind, but like we have a number of ministries conducted such summits or you come up with good recommendations, having good discussions, and then sometimes Junubin generally doubt the implementation of such communiques or let's say the outcomes. They shelf, they think the ministries or the government normally shelf whatever recommendations they come up with, but then it's not being translated on the ground. So how can the Junubin now trust this will work out from the Ministry of Health?
Yeah.
Yes, Rumun is laughing. He can add something later on that. Yes.
Yeah, thank you so much. And I think these questions is one of the most important questions. And you know, when we actually the Minister of Health plan to have these summits, does mean it has already put a number of plans and a number of activities that actually to be addressed after the summits. And summits is an opportunity for healthcare workers in the country to generally bringing the issues related to the health from the grassroots. You know, we wanted to ensure that we hear from somebody who is in Akobo or somebody who is in Raja or somebody who is in the village down there, what are the health issues, what they are facing in health issues. And we know there's some common issues that we commonly know, but we also wanted to hear we have issues related to healthcare are not being deployed properly. We want to hear whether they have a number of healthcare workers and why they are not performing, and issues related to that. We need to ensure that we discuss about the commodities and why commodities are not reaching there. We also wanted to address the issues related to the services and why the services are not provided. So all these issues we definitely will come up in the summit and will be discussed very comprehensively. And Minister of Health now will use this opportunity and will use the information that we have from these ones to put our strategic plan. Although we have our strategic plan, this one also is an opportunity for us to review our activity in the previous period. We have been implementing our strategic plan for the last 5 years. Now this one also is a part of the review program for our strategic plan, and then it will help us in the developing a new strategic plan where we will definitely tackle issues that we normally know that is difficult for implementation of our strategies is actually issues related to finance, and health finance in the country is one of the most challenging situations. But at the moment, the leadership of the Minister of Health and together with the government are putting a lot of priorities on health in the country. And maybe you have heard of recently that the government budget for the health also is going to be improved on these aspects. So definitely the issues that we are discussing will get a room for the government to implement them in the nearest future. You see, and there is a strong commitment also that we are working with our partners, and we have a number of partners that are actually also giving a pledges to ensure that we continue and provide healthcare services for the people of this country.
Right.
So it is generally we wanted to say that what we are discussing in the summit, there is a very focused area of ensuring that we will implement.
Right.
Yeah.
Right. And Dr. Rumuna, I want you to bring you in also to talk about the expected outcomes as well, its implementation.
Okay. Before I go to the expected outcomes, I just want to add to what my colleague has said.
Indeed.
let me modify to success factors. Yes, we are seeing a lot of success factors. My colleague already mentioned hearing from people in the front line. Of course, we are getting our colleagues from the states to participate in this summit, and more importantly, the participation of political leadership at the level of presidency. In this planning, the VP, Her Excellency Josephine Ilagu, has been with us, excited to see this happen. And the patron for this summit is going to be His Excellency President Salva Kiir Mayardit. And as my colleague said, the issues related to low funding of health sector in the country has now been tabled. Last week, the Honorable Minister Sarah Kiletu and the country manager of the World Bank, as well as Ministry of Finance and WHO, were in a high-level health financing discussion, and a lot of way forward has been, put forth, and I think this time around we are very glad and thankful to our leaders that there is attention to health. Health is an asset. Nations' productivity depends on healthy citizens. Yeah.
Right.
Now, going to the question on the expected outcomes, as my colleague laid the foundation of key activities that will happen. Those activities will lead to common understanding of the sector status and priorities, and then the state of health among stakeholders, and recognition of best performers, and the consensus will be reached between Ministry of Health and technical partners for different thematic areas, which was laid out here earlier. And also consensus will be reached across sector on issues and priority moving forward. And more exciting is the launching of the ministerial initiative on newborn health. As you know, our maternal mortality is the highest, I think, in the world. And finally, there will be a communique of the summit with clear next step, way forward, and recommendation for forging new policies and strategies, as my colleague has already alluded to earlier. Thank you.
All right, thank you for that. Bring us to about 12 minutes to the top of the hour. Let's now continue to, pick a few calls. 0911 or 22986 or you can send a text to 13986 or drop your comment there on our Facebook page. We're talking about the upcoming event, which is the Health Summit here in the country. I'm joined live in the studio by two doctors, senior officials from the National Ministry of Health. And we also have some comments here. Let's speak from Kevin Tize saying congratulations for the upcoming Health Summit. Emmanuel Joseph Akile, I'm a student of psychology, therapist of PSTD trauma healing. I would like to attend the summit, inshallah. This is Dr. Akile. Philip. Yes, guests can later comment on that. But for now, we pick few calls. اتصل علينا وقدم سؤال بتاعك بكل اختصار لضيوفنا في الاستوديو قبل ما هم يرفعوا لبعض من الأسئلة بتاعك، وخاصة في موضوع بتاع مجال الصحة عامة هنا في جنوب السودان.
أي راديو لأخبار الموزون اللي تكون بيتمت فوقه من كل جنوب السودان ومن برا جنوب السودان. أسمع تكون لأي راديو أنا تكون في جنوب السودان.
Good morning. Good morning. It's iRadio.
يس مرحبا بك مرة ثانية مستمع راديو. ده الوقت اللي نواصل وخلينا نرفع بعض من المكالمات. قدم سؤال بتاعك لضيوفنا في الاستوديو على ارقامنا 11 و 22 986 986. حلو راديو.
هاي راديو جزء وكالة.
يس.
كيف؟
تمام.
معك دينغ في جندرو.
دينغ من جندرو، تفضل.
هاي طبعا المجال بتاع السعادة ده مجال أكبر مجال وأكبر المجال للشعب كله. طبعا بكلم ما عندنا مسيفة كيف بقولوا جاغول ده تجاغون مشار تماشي لمرول دينغن مسيفة فتولينا السنة اللي فات وحتى حاليا عدوي ما في نهائيا وعندنا يالي هناك. وهل ده عادي قاعدين نمشي وين ما قادرين نعرف كله ودكتور جالس قدام ده هاي وحيد اللي نقوله. نمرة 2 بدو الشبكة ذاته تعبان هناك ومسيفة مش عملوا مسيفة كبير تمام جدا يعني هو بعمل خدمات شديدة للناس لكن الناس ما بودي عدوي يعني بكلم ما نجي عليه هناك كله هسه يجرب يشيل من جاول نجيبه في نعمل نجي نعالجه هنا عشان حاجة ده لو الناس الجاي ده قدامك ده لازم حاجة ده يعملوه يشوفوه ما يعني الناس.
Okay, شكرا جزيلا دينغ لمشاركة بتاعك. And that brings us to the issue of key challenges facing the health sector here in the country. The issue of shortage of medicine or drugs في healthcare centers. خلينا نرفع مكالمتين قبل ما نجي ل guests in the studio عشان هم يجاوبوا للأسئلة والتعليقات بتاعك. اتصل علينا لسه على أرقام بتاعنا 11 و 22 986 986 وهذا بجيبك دايركتلي في استديوهات اي راديو في صباح اليوم. And some comments here again on our Facebook. We have Rejoice is again asking, what are some of the steps taken to ensure respectful maternity care in the health facilities? That's the question she's asking. And the second question also from a listener here is saying, what monitoring systems are in place to track progress on maternal health indicators? This is a real student of student computer medicine in asking very important and interesting questions there. So yes, I come back to, I guess, in the studio. I think the line is still breaking there, but we have Deng. Maybe we can start with Deng, and then maybe Dr. Mono, we can respond to Deng. Modo with Adui medicines.
Thank you, Deng, for the question. In fact, we have 6 pillars for health system, and these pillars include pharmaceutical supplies like medicines as well as human resources, and they all fit into service delivery. Deng is right. If there is no medicine, definitely people who present to the health facility will not get treatment. We have noted this challenge, and it will be handled within the current plans to resolve the issues of shortage of supplies all over the country.
All right. Yes, Dr.
Yeah, thank you. And
Rejoice,
I will respond to the question from Rejoice.
Yes.
And I think she's asking about what are the services that are provided at the maternal and newborn services in the country. Of course, South Sudan is one of the countries that we have most health indicators in especially for maternal and child in the country. At the moment, the projection is showing that under 5 mortalities, 99 deaths per thousands live birth, and then neonatal mortality is the highest also in the world and in the region, which is about 40 deaths per 1,000. And maternal mortality is the highest, of course. Our last projections shows that we have 692 per 100,000 live birth. So if you see these indicators, it's showing that the South Sudan is one of the areas that when women are giving birth, they are at risk of dying. So the Ministry of Health has put a number of activities to ensure that we reach with the healthcare services to our people. And in our health systems in the country, it starts from the community program that we have. We ensure that there is a package that will provide at that level to ensure that our mothers who are not having opportunity to visit the facility to healthcare, they have a services that can be provided to them at the community level. We call it a Boomer Health Initiative. And then at that level, there is a community health workers that they will ensure that there is a pregnant mother in that society. They will give them iron folic acids, and then they advise them to visit the facilities. When you go to the healthcare to facility, we ensure that we have a trained healthcare workers in this and in the primary healthcare centers that they can provide a basic healthcare systems, healthcare services in that level. And we ensure that there is at least a minimum service that can be provided. So a mother can visit the primary healthcare center, they can be safe with the delivery and ensuring that they are tested, all the tests that are necessary needed. And the same thing also, there is a referral platform that has already been established also to ensure that if this mother needs a cesarean section, that they are referred to the secondary level services in the state hospital, and so these are secondary level that. So there is healthcare systems in the country that works actually to address issues related to mother and the children in the country. Yeah.
All right, bring us to about 4 minutes to the top of the hour. Let's pick one more call before we can wind up our conversation for today. You still have a chance to dial 0911 or 22986 Anthony Bandas is asking on our Facebook, and he's saying malaria cases in Juba before or back in the days, it was actually spraying at house and air, or this issue of spray. That's what he's talking for the prevention. And so, any plan now? Like, why is asking? Like, why do we continue to have malaria? And this is an issue. Like when you go to other countries, when you have malaria or even quarantine, why is it an issue here in South Sudan? Of course, we are part of Africa, and this is one of the challenges we can be facing. But how can it really be addressed holistically? But pick one call, and then you can respond to the two questions together. Radio? Yes, get back on 0911-986-986. اتصلوا لنا بكل اختصار. في واحد متصل قاعد يتصل من قبل، وخلينا نرفع المكالمة بتاعك. أرجع تاني نديك ثواني قليلة عشان نقدر نرفع المكالمة بتاعك، وبعد ذاك حنرجع لضيوفنا في الاستوديو. Hello, Radio. Radio. Alright, فقدناك في الخط، خلينا نرفع تاني. Radio.
الو.
يس.
اي صباح الخير.
صباح النور.
معك سوزانا جورجي من واو.
سوزانا، على الأقل لقينا 35% الليلة. تفضلي. تفضلي سوزانا. نعم.
أنا سؤالي أقول كده إنه في مشكلة بتاع الأورام بتاع سرطانات يومين ده في ولايات جنوب السودان. فأنا ما أعرف الناس العيانين ديل بيعملوا فحص من وين. ده واحد. نمرة 2 بعض مرات ما في أخصائيين في الولايات بالذات. لما تلقى زول عيان وماشي مستشفى أنت ما بتلقى أخصائي عشان يوريك المرض بتاعتك. يعني ناس بيكونوا ملخبطين، وبعض مرات ما في أدوية ذاته. وعشان كده أنا قاعد أسأل عشان الدكاترة ديل وريني الحل وين. شكرا جزيلا.
Alright, شكرا جزيلا. Yes, لأنه الزمن بيقى ما لسه علينا. We have less than 3 minutes now to wind up. Maybe Dr. Romano, you can respond to the questions generally. Yes.
Yeah, let me start with Susan. Susan George من واو. شكرا جزيلا. موضوع أورام والسرطانات وكده فعلا ده مشكلة. قبل دكتور مايكل يتكلم عن مواضيع اللي نحن هنناقشه في Health Summit including non-communicable diseases. non-communicable diseases ده أمراض يعني غير المواضيع. واحد منهم هو كانسر أو السرطانات. فالخبر الكويس يا سوزان إنه السنة ده وزارة الصحة فتح ديبارتمنت جديد وسنتر لكانسر في جوبا تيتشنج هوسبيتال. لسه يعني work in progress، وإن شاء الله في أوقات الجاية حيكون في أخصائيين. حاليا هسه عندنا أخصائيين موجودين في جوبا، لكن يمكن ما وزعهم في أنحاء البلاد. فالشغل بدأ إن شاء الله حيصل في جميع أنحاء البلاد. أما بالنسبة ل
specialist أخصائيين يعني
أخصائيين في ما كتير، لكن ده هسه يعني في عندنا استراتيجيات عشان ما نزيد عدد بتاعت الأخصائيين في مجالات المختلفة including cancers.
Alright. عندنا أقل من دقيقتين. I give you each maybe a few seconds for your last message. Let me start with you, Dr. Mading. What would you say to the public as we wind up our conversation ahead of the Health Summit?
Yeah, this Health Summit, as we put it from the beginning, it is a platform for everyone to participate, and it is also an opportunity for Minister of Health also to hear from our people and the public and issues related to the health, and also how the country will improve the healthcare service in the country. So الناس في جنوب السودان كله مسموح لهم ان يتابعوا الاحداث اللي بيحصل في فتره في المؤتمر الصحي ده، ونحن بنطلب ان اي زول ممكن يشاركنا، وعندنا very big coverage. هيكون في مجموعة كبيرة جدا، الناس ممكن يتابعوا وناس ممكن يدوا آراءهم، وعشان آراءهم ده كله نحن بنشيله وبنحطه في الاعتبار في الفترة دي. فده فرصة لكل جنوبين ولكل ناس في جنوب السودان عشان يشاركوا في مؤتمر الصحي ده.
شكرا جزيلا. Yes, Dr. John.
نعم. Thank you very much for giving me this last word chance. In fact, the Health Summit is coming at a very opportune time. And for the first time we are really elevating the issues of health to all of government and all of society approach, you know, because health is not only for Ministry of Health. ببدأ من بيت لغاية في كل المصالح الحكومية وكل هنا. فده بوديني لسؤال بتاع أخ أنتوني بنداس عن ملاريا. ملاريا ده نحن كلنا ممكن نتكاتف عشان ما نقدر يعني to make sure that we control it and we eliminate it. If all of us put our hands together to ensure that we have clean environment, to ensure that everyone is having long-lasting insecticide-treated nets and sleep under it, and soon we were now planning to distribute nets all over the country. Actually, we are planning for it, and I think it starts
mosquito nets,
mosquito nets. Yes, yeah, and that's our main strategy for prevention for now.
Right. Thank you very much, Dr. John Romunu Pasquale, Director General for Policy, Planning, Budgeting, Research and Monitoring and Evaluation, and Dr. Michael Mading, Director General for Reproductive Health Board from the National Ministry of Health. Thank you for joining us on the Dawn today ahead of the Health Summit next month. Thank you. Hope to have you again soon.
Thank you so much.
Right. With that, we have come to the extended hour of the Dawn edition for today. Join us again tomorrow morning at the same time to get the latest, or join us on Monday rather, again to get the latest on what's happening in South Sudan and beyond the borders. Up next is the Soundtrack Show with Dico D. Andrew and her co-hosts. On behalf of the Dawn team, Paulino Ate, Darlington Moses, and producer Dico D. Andrew, this has been Emmanuel Joseph Akile. Have a great weekend. Stay safe, stay blessed. We catch up again on Monday.